Hey guys, how's it going? My name is Johnny Banzon, and today I will be presenting a study that my groupmates and I have conducted for the past few months. So this research is entitled Veterinary Parasitology, the Preventative Measures and Solutions to Combat Rhizocephalus sanguineus Infestations Amongst Canines in Tagum City, Philippines. This study tackles and elucidates several preventative measures and solutions to combat brown dog tick infestations amongst canines in Tagum City, Philippines, whereas specifically this study expounds causes of such ectoparasite transmissions and its seasonal dynamics. We have chosen to specifically target Rhizocephalus sanguineus as it is the most common and prevalent species of ticks found all throughout the Philippines, and that Philippines, being a tropical country, constitutes to be a very suitable place for brown dog ticks to thrive prolifically. Thus, the rampant cases of brown dog tick infestations in our research locale needs to be addressed.
Greetings everyone, my name is Yana Sanratiabagas and I am here to talk about Rhizocephalus sanguineus. Rhizocephalus sanguineus is a three-host tick, meaning that it feeds only once for each 3 stages. They can be found on dogs' ears and interdigital spaces between toes. Each female will lay eggs once, numbering from 7,000 with 4,000 on average depending on the size or the amount of blood the female tick ingested. As shown on the slide, the larvae and nymph stage will consist of attaching, feeding, then detaching until adulthood. Though they infest dogs, they can also infest wild hosts like cats, rodents, birds, and humans. They may also carry pathogens such as bacteria, spirochetes, rickettsia, and so on. Their behavior vary depending on geography and seasons, where the dry season has a significant increase on infestation. It should be known that humans will be susceptible to them as warm temperature increases. With that said, we can also expect more diseases spread by the brown dog tick to appear in the future. After more than 110 years of research on Rhizocephalus sanguineus sensu stricto, there is still no type, no solid definition, and no agreement on the range of morphological variation within the species.
Tick-borne pathogens that Rhizocephalus sanguineus may carry Rickettsia miscellate that infects the skin, lungs, brain, and other organs through the bloodstream, and Mediterranean spotted fever. The poisonous chemicals in anti-tick shampoo are pesticides that includes organic phosphates, carbamates, perathins, and synthetic pyrethroids. The preventive elements for the anti-tick shampoo is adding slow release of 2-benzaldehyde and 2-hexanone formulations to reduce the quantity of ticks on dogs, according to earlier research. Medicinal plants include custard apple, stemina, peritium, neem tree, and Tagetes patula L, and 12.5% of pyrrole topical solutions on shampoos.
The findings of Torres 2010 indicates that three-host brown dog ticks are mostly associated with dogs. These ectoparasites are present all year round and they are much more prevalent during dry seasons, resulting in more cases of infestations, human attacks, and diseases. In the anti-tick shampoo, Walenga and Gregg 2020 previous research conducted derived that some poisonous active pesticide ingredients need to be avoided: the organophosphates, carbamates, pyrethrins, and synthetic pyrethroids, and when ingested with dogs, it can poison them. Medicinal plant extracts can also be used as an element to eliminate brown dog ticks. These are stemina, which is 12.5% effective, dwarf marigold, which reduced egg laying by 21.5% and eliminated 99.78% of larvae, patchouli oil, which can be an alternative of ivermectin, and Atmela oleracea hexane extract, which show damage to the ovary of the engorged female.
Domesticated dog wandering freely in Tagum City, Philippines can be a source of concern in locality as they are mainly the host of Rhizocephalus sanguineus or brown dog ticks. With the increased spread of ectoparasite affecting both human and animal health, researchers found an anti-tick shampoo ingredient that primarily contain natural tick repellent chemicals for the prevention and eradication of brown dog ticks. In conclusion, this study aimed to examine the prevalence of brown dog ticks, identify the preventive measures that dog owners can perform against brown dog tick, and determine the physiochemical properties of anti-tick shampoo and assess the performance and efficacies of the gathered preventative solution against brown dog ticks.
Good day, everyone. This is the Group 2. I am Novels and P. Kadungog.
I am Christian Prime de Escalo.
I am Hannah Michael Chua.
I am John Tyrell Kahutol.
And this is Deobika Sinabi.
And we are gathered here today to represent our research study entitled Homeless Canine Assistance, Establishment of Homeless to Greatness Sterilization and Care Program at Magsaysay, Lanao del Norte. There are many dogs wandering the streets of Magsaysay, Lanao del Norte. These stray dogs are not provided adequate attention and care by their owners, which causes them to wander and seek food on their own. These dogs may also cause vitamin and nutritional deficits, as well as devastation and illnesses that may infect people. In order to remove this, the researchers created an excellent initiative that aims to provide adequate care for these companion species to eliminate any further difficulties they may cause in the community.
The researchers aim to establish the Homeless to Greatness program for stray dogs that are captured, neutered, or sprayed and take care of as a preparation for adoption. This study aims to assess health conditions, evaluate the sterilization needs, design a sterilization and care program, institute and examine the effectiveness of the sterilization and care program based on the post-general conditions of the stray dogs after a year in the vicinity of Magsaysay, Lanao del Norte.
Methodology. Data evaluation. Respondents will be collected among 1/3 of Magsaysay, Lanao del Norte's population through survey, and observation will also be done among stray dogs present in the study site. Development of Homeless to Greatness. Dogs will be impounded and will be undergoing extensive treatment. Afterwards, they will be sterilized and will be prepared for adoption. Opening for adoption. All canines will be treated and will be sterilized to become qualified candidates for adoption, reducing the rate of unwanted dogs. Researchers will facilitate the opening program for adoption for these companions. Photo recording. Photo documentation is done to show that the researchers have completed their work and used the materials and complied the aforementioned processes.
As for the findings, please refer on the bar graph for you to be guided. So as you can see, the completed survey garnered a total of 100 stray dogs in Magsaysay, Lanao del Norte. 53 of it are males and 47 are females. Among the male canines, 21 are wounded and 26 in female canines. And out of the wounded dogs, there are 2 severely injured males and 4 female dogs, which are unqualified for sterilization. To summarize the given data, 94 canines are qualified for sterilization, of which 51 are males and 43 are females. After a general checkup and sterilization, 94 dogs are now ready for adoption. Out of the 94 dogs, 75 street dogs have already found their homes. 44 are males and 31 are females, while 19 dogs are still waiting for their owners. 7 are males and 12 are females. So that's all for the findings.
Dogs are not our whole life, but they make our lives whole. Dogs, or stray dogs, are part of our community and part of our family. We individuals must keep ourselves responsible enough for being a responsible pet owner. Nurturing or spraying our pets is a crucial way to keep them healthy and reduce overpopulation. Homeless to Greatness program proved that even stray dogs are important and deserve to be treated for the dog's benefit, the owner, the community, to reduce risk and diseases that the dog may cause. Results showed a positive response against overpopulation in stray dogs at Magsaysay, Lanao del Norte. In summary, saving one dog will not change the world, but surely the world will change forever for that one dog. That's all. Thank you.
poultry sector plays a vital role for every chicken farmer in Santo Tomas, Davao del Norte, Philippines. However, as stated in our needs assessment report, one of our respondents mentioned that coccidiosis has been the most pressing issue in the poultry lines. The Food and Agriculture Organization defined coccidiosis as a disease caused by different types of coccidia present in the intestinal tract of poultry, where it could impact productivity as well as chicken health and food safety. Additionally, Constable 2015 expounds that it is most prevalent under poor nutrition, poor sanitation, or overcrowding, where the clinical signs include fever, diarrhea, inappetence, emaciation, weight loss, and in extreme cases, death.
The present study evaluates the effectiveness of aloe vera and ginger extract against coccidiosis incidents, mainly the protozoan parasite coccidia or oocyst in the poultry lines of Santo Tomas, Davao del Norte, Philippines. Specifically, this study aims to 1. Assess the needs of poultry farmers regarding the menace brought by coccidiosis. 2. Determine the properties of herbal plants against the protozoan parasite coccidia or oocyst at the available laboratory within or nearest in Santo Tomas. 3. Compare its efficiency to the most common drug treatment used by the chicken farmers against coccidiosis. And lastly, 4. This study aims to gather information from the mentioned review of literature to strengthen and support the effectiveness of aloe vera and ginger extract against coccidia. By linking these, a strategy is formed to resolve the issue.
These are the highlight authors and readings that the research banked on. Studies of Bokmat et al. 2020 and Akhtar et al. 2012 assessed the protective effect of aloe vera against coccidiosis. Ahmad et al. used 360 chickens and were divided into 5 groups, the positive, negative, and prolium, and the groups treated with aloe vera in 2.5 and 5 grams. For Akhtar et al., it was divided into 2, the evaluation of the immunostimulatory activity and the protective efficacy of aloe vera extracts. Meanwhile, Ali et al. 2019 and Zhang et al. 2011 studied the anti-coccidial effect of ginger on experimentally induced coccidiosis in broiler chickens. For Ali et al., 240-day-old broiler chickens were divided into 6 groups. The control groups and the chicks supplemented with garlic, ginger, and amprolium at 5 and 15 grams per kilogram feed and 1.23 grams per liter of drinking water. Zhang et al. used 144 one-day-old chickens to assess the effect of dried ginger root.
The study of Ali et al. 2019 proves that it improved the shedding of oocysts, lesion score, and histology of small intestine in chicken given ginger and garlic supplementation. Also, it boosted the chicken performance and the coccidiosis effect in chicken. The study of Zhang et al. 2011 shows that ginger supplementation tended to increase the growth rate of broilers and increase the carcass yield without affecting the feed intake or feed conversion rate. Furthermore, Ahmed et al. 2020 affirms that the oocyst count, lesions in fecal and intestine were significantly lower in chickens treated with aloe vera. Additionally, Akhtar et al. 2012 concluded that aloe vera might be a potential and valuable candidate to stimulate immune response and be used successfully as an immunotherapeutic agent against poultry coccidiosis.
Thus, the current researchers in this study can confidently infer that aloe vera and ginger extracts can be used and have a potential on treating the protozoan parasite Coccidia and oocyst. Revealing those findings from the related studies, action would be possible to ensure that the treatment is regulated adequately to resolve the arising coccidiosis in poultry industry.
The parasitic worms that resides inside the host's lungs, heart, and blood vessels, as suggested by AHS in 2014, are the main causes of heartworm disease. Internationally and locally, its interventions include treatments and medications such as antibiotics that helps fight against the parasites within the host's body, as presented by the WHO in 2019. Also, preventive medications and cleanups are prioritized here in our country. Further diagnosis can be done through parasitological, serological, and molecular tests. In literature, the prevalence of heartworm infection in our country are often not taken as a research focus as compared to other countries. Our study covers SDG 3 or Good Health and Well-Being, as it focuses on determining the prevalence of heartworm infections on canines and felines, and inclusions are its present status, analysis of its patterns, and comparison of incidences within Davao City.
Heartworm is a parasitic threat worldwide. Mosquitoes cause the spread, and canines and felines are the notable reservoirs of parasite Dirophilaria immitis. It is a filarial nematode that generates heartworm disease, which causes minor and significant symptoms, such as cough, disinclination to exercise, tiredness, decreased appetite, and weight loss. As heartworm disease advances, pets may develop heart failure and swollen belly due to excess fluid in the abdomen. Canine heartworm is primarily prevalent in the United States due to the identified factors that influence the dogs likely to have heartworm, such as the annual temperature, county elevation, and mosquitoes. In Southeast Asia, the filariasis which causes heartworm is also a common health problem in tropical and subtropical area. The frequently found species of filarial worm in dogs in these regions is Dirophilaria immitis. Preventive treatment is profoundly recommended. Doxycycline is a canine adulticide heartworm treatment that kills developing larvae, and ProHeart12 amoxidectin. It inhibits the development of Dirophilaria immitis in canines.
The filarial nematode Dirophilaria immitis causes feline heartworm disease. Dogs are the definitive host, but cats may also be infected. A cat's presentation can range from asymptomatic to chronic respiratory symptoms. Clinical signs of heartworm in felines are typically non-specific, consisting mostly of respiratory symptoms but often gastrointestinal issues. And also, the common asymptomatic form of feline heartworm is the animal's sudden death. Some self-cure without showing symptoms as a result of parasites dying naturally in infected felines, while others develop an acute respiratory syndrome without indication. However, there are no relation between outer exposure and heartworm infection. All indoor cats are still at risk for heartworm infection. Therefore, felines, regardless of lifestyle, should be treated with heartworm prevention. Heartworm was already evident many centuries ago. In 1586, Wolfe found an unknown creature inside the heart of a horse. Later on, the sketches he called monsters were identified as Dirophilaria immitis. During this time, canine heartworms were first discovered at the southeastern coast of the United States. But it was not until the 1920s when the same agent was also found on infected cats. Subsequently, most of these infected animals are asymptomatic and show no clinical signs. The prevalence of heartworms on canine between 1993 and 1997 on the overall population of adult dogs were 57% and are still increasing up to this day.
The vertebrate nematode started in the mid-19th century. By 2014, a device was developed to determine which among the various mosquito vectors transmits the parasite that causes heartworm. By 2018, the 3-dose similar-semin protocol has been prescribed for infected dogs and found out that it results in minor complications, so reduction of dosage was applied. In 2020, researchers discussed 4 cardiovascular complications that will happen when a dog has heartworm disease. The study emphasized that the treatment administered should be according to the type of cardiovascular complication, and the findings showed that these medications treated heartworm infections in dogs successfully. Moreover, a routine year-round heartworm preventives in dogs and cats are recommended, and owners must follow preventive measures to prevent the spread of the disease. Hence, prevention is the most suitable method to avoid infections caused by biological factors. Studying patterns of heartworm disease is the limited data. There are some places where the heartworm cases are not well documented, thus infecting more hosts and rising populations of unrecorded occurrences of heartworm infections. Also, Marcucci
This is the Group 5 and we will present our study entitled Veterinarian Shaming, Anthology of Undignified Experiences Among Veterinarians. This presentation is organized as follows: Introduction, Objectives, Search Methodology, Findings, and Conclusions.
Britannica Dictionary defines veterinary medicine as a branch of medicine that ensures the health and well-being of animals and humans. Based on conduct needs assessment in regards to the problem encountered in veterinary medicine, veterinarian shaming is one of the problems encountered by veterinarians in the workplace. Shaming is the act or activity of subjecting someone to disgrace, disrepute, humiliation, especially by public exposure or criticism. CanVet 2015 highlights that this issue relates to suicide and non-fatal suicidal behavior problems. The rate of suicide in veterinary medicine has pegged to close as twice in the dental profession. Most of the related studies are conducted internationally and little to none are done locally.
Objectives. Generally, this study aims to establish an intervention program for coping mechanisms among veterinarians and people that works in veterinary field. The specific objectives include document the experiences of veterinarians, determine the challenges experienced by the veterinarians, identify the coping mechanisms of veterinarians, assess the effectiveness of coping mechanisms, develop the intervention program, and evaluate the effectiveness of the intervention program.
Search methodology. Since the study is an extended review of related literature, only scholarly literature written and published in English from 1990 to 2021 met the inclusion criteria. Database used for searching relevant materials includes Google Scholar, government websites, reference list of published papers, and professional websites. The study will be able to know the various causes of vet shaming, provide help to the veterinarians, create a possible way to overcome it, establish ways to redeem their confidence.
VM1B acknowledges progress in studies taken to better understand the mental health and well-being of veterinarians, but highlights numerous gaps in understanding veterinarian mental health. Bartram and Bonnewell suggest the following to assist in achieving well-being. 1. Developing and maintaining close personal relationships. 2. Looking after your health and getting enough sleep. 3. Keeping a sense of perspective. 4. Regularly engage in activities that create flow. 5. Savor, be grateful for, and reflect upon the good things in life. Expect money to bring you happiness. 7. Engage in meaningful activities. 8. Be yourself and be content with who you are. 9. Develop a sense of control. 10. Learn to be optimistic. 11. Give yourself regular treats. 12. Simplify. 13. Only take time to choose carefully when the decision is important. And 14. Be good to others.
Conclusion. In 2016, Hamilton stated the importance of taking a proactive approach to veterinarian well-being cannot be understated. Veterinarians are at a risk of psychological ill health and suicide due to multifaceted components required of them within their day-to-day working lives. This psychoeducational intervention program developed will go a considerable way of providing a psychological-based effective intervention for veterinary and animal industries. It is strongly recommended that the governing and professional bodies of this profession, together with health professionals, veterinary employers, and educational institutions offering studies in veterinary science to step up and take notice of this profession, and to advocate for further research into appropriate intervention programs.
know that pigs experience constipation the same as humans? This is because 84% of pigs' physiology and genetics are the same as humans. Now, you might be wondering, why do I tell you this? I am Kyle Angela Martin, and I am one of the researchers. Stay with us as we present to you our research entitled Swine Rectal Prolapse in Cabacan, North Cotabato, assessing the efficacy of fiber-rich organic feeds in preventing constipation and straining and bowel movement. From our needs assessment, most swine raisers encountered vaginal and rectal prolapse on their sow. One solution for this problem is to slaughter the animal. This issue affects the income of the farmers and the demand for meat. Sow mortality has also risen notably in the US due to this problem. Lindbergh appends on 2014 that dietary fiber can help in pigs' nutrition and gut health, but the study does not include the benefits of the fiber for the prevention of rectal prolapse.
Good morning. In this study, we aim to assess if our product is efficacious or not. So, specifically, we have to evaluate the prevalence of the incident. We have to identify possible preventive measures. We have to determine the physical and chemical properties of our product and test its performance on pigs. So, we have here four most relevant studies. So, first is from Jarrett and Ashworth in 2018, wherein dietary fiber can improve the retention time of the stomach and can prevent later satiety. So they basically emphasize here that including fiber in a pig's diet can help maintain a normal physiological function of the digestive system. Next is a case study from Njoku et al. About the lack of enough water intake. So they have discussed here that constipation is what caused the rectal prolapse, and that one of the causes of constipation is the lack of enough water or dehydration.
Pigs and humans are similar because of their anatomical structure and function. Also, cardiovascular system and gastrointestinal tract and pancreas, so that there are possible that human and pigs are the same treatment for the diseases. Transanal endoscopic microsurgery is a safe technique and provide improved access to lesions in the middle and upper rectum. Thus far, it has not had a significant impact in the overall treatment of a rectal cancer.
Water intake and fiber plays a major role in the defecation frequency and stool quality. Adequate water intake is highly needed at times when the consumer is eating hardly digestible food materials, as water will help loosen the stool, making excretion smooth and easy and thus preventing constipation. Fiber, on the other hand, doesn't only help promote intestinal balance, it also helps control the relative presence of good and bad bacteria and helps fight and eliminate pathogens present in the intestines. In addition, the intestinal tract of persons and humans are very similar in terms of anatomy and physiology. The urinary and digestive systems of swine, to name a few, are very much similar to that of the humans, making swine a considerable animal model for biomedical experimentations and researches. The use of swine as animal models for treating rectal prolapses have been done before. In 2015, a group of researchers have used transanal endoscopic microsurgery to perform sigmoidopexy on 6 swine cadavers with rectal prolapses. The result was successful, thus they have recommended that the procedure be used for future practices.
According to the relevant research that we reviewed and collected, we found that constipation is caused by dehydration and the lack of enough fiber in the swine's body system. One of the symptoms of having constipation is straining. Frequent straining can lead to rectal prolapse. Water intake in general is one of the contributing factors that affect the frequency and quality of the stool. Constipation is caused by the ingestion of food that is insufficiently hydrated and cannot be digested. It is also recommended to use a high-fiber diet for farrowing sows, since their bodies require a high-calorie diet during lactation. After this discovery, post-discovery steps should be taken to ensure that the sows get better water intake while maintaining a high-fiber diet to solve this problem in sows with rectal prolapse. And that concludes our findings about this research. Thank you.
Hi, I'm Austin J. Putor from VM1B, and I'm going to discuss the research title and the rationale of our study. So we all know that a research title must also be the summary of our research study. So we come up with this research title, But Acquired Rabies, an analysis of rabies lyssavirus on Theropus or the Flying Fox at Sumalsag Cave in Manolo Fort Ridge, Bukidnon. So the rationale of this study is that the reason why we conducted this study is that we want to know if the bats inside the Sumalsag cave are infected with the rabies virus, and we wanted to analyze how did they acquire it and how did they develop it, since Sumalsag cave is one of the tourist attraction in Bukidnon.
Now on the objectives of the study. Generally, this study aims to analyze the pathogenesis of rabies virus on flying foxes at Sumalsag Cave, Manolo Fort Ridge, Bukidnon. Specifically, this study aims to number 1, evaluate the presence of rabies virus. Number 2, determine the host resistance of the rabies virus. Number 3, identify its fatality rate. And number 4, ascertain the site of exposure of rabies virus at Sumalsag Cave, Manolo Fort Ridge, Bukidnon.
My name is Fritz Lester Pedroso, and I'm going to present you the methodology of our study. The respondent of our study are 5 flying foxes with the age of 30-day-old. We used purposive sampling to purposively select those flying foxes with the same age and those that are healthy. When it comes to data gathering, we use the RT-PCR system for the collected saliva and skin biopsy of the flying foxes to determine which among them acquired the rabies virus infection. Before we start our study in Sumalsag Cave, we ask permission to the authorities to allow us use those flying foxes for the specimen of our study.
I am Vera Alexis Pala, and I am the leader of this group, and I will be discussing our findings. So using the RT-PCR test, we found out that with the blood samples we acquired, only 1 from the 5 flying foxes were infected, but basing on the study about the pathogenesis of the bat-acquired virus, it shows that the histological site of exposure is usually limited to the skin. So we performed a skin biopsy, and it showed that 3 of the 5 flying foxes is tested positive of the rabies virus.
I am Berlanami Poblador, and I will be discussing our conclusion. The garbage in the cave indicates that it could be the reason why these flying foxes got infected with the rabies virus, where they could have touched or garbage was thrown at them, and then since Benjamin et al. 2018 found that the histological site of exposure is usually limited to the skin. This study recommends implementing environmental laws and preserving the cave's natural features.
Research rationale. First is the risk factors, the sanitary measures and awareness of the local hog raisers towards African swine fever. The effectiveness or ineffectiveness of these measures will be held accountable if the ASF on hogs can't be prevented nor be cured. Second is vulnerability. The vulnerability of local hog raisers is at risk, considering the number of hogs that enters in and out of the community is the main reason why the local hog raisers should be on guard and be prepared in combating ASF. Third and last is adjustments. Adjustments made by the local hog raisers in the community on different areas like producing, transporting, and sanitation of the hogs, and also the people who comes in and out greatly affects the usual routine. An instant adjustment with great results is difficult to achieve. That's why it is important to assess what to do, what not to do, and be aware of any updates about the disease.
Objectives. Generally, this study aims to investigate hog raisers' knowledge about their vulnerability to ASF or African swine fever extracted from domesticated pigs in Malaybalay City, Bukidnon, Philippines. Specifically, this study aims to, first, examine the prevalence of local hog raisers in Malaybalay City, Bukidnon, Philippines regarding the African swine fever towards establishing a preventive measure. Second, determine the risk factors of the African swine fever to the hogs of the local hog raisers in Malaybalay City, Bukidnon, Philippines. And third, evaluate the sanitary measures of local hog raisers against the African swine fever in Malaybalay City, Bukidnon, Philippines.
For the methodology, this study will utilize a quantitative research design method that aims to gather in-depth insights of the local hog raisers on evaluation of risk factors and sanitary measures about African swine fever, or ASF. A face-to-face interview will be conducted by randomly selected 15 hog growers. Rest assured that the data gathered will be confidential and will be used for research purposes only. The farmers' socio-demographic information, health management, safety measures, and understanding of ASF were among the questions asked. The data will be analyzed by using works of literature related to the study with the help of an expert and interpret the results. The questions are divided into 5 categories, namely Category 1 with 1 question, then the Category 2 with 7 questions, the Category 3 with 4 questions, and Category 4 with 18 questions, and lastly Category 5 with 4 questions.
And these are the findings of our study. The local hog raisers of Malaybalay City, Bukidnon have enough understanding about the African swine fever. As you can see, the graph implies that 76% knew about the ASF and ready to deal with it. Based on the survey, they also know about how to properly maintain the health management in their piggery. Like 70% of the local hog raisers know how to work inside the piggery. Half of the local hog raiser respondent houses is 1 kilometer away from their piggeries. They are aware of the different safety practices against the African swine fever. Their pigs are also vaccinated to make sure that they are away from any bacteria. The 54% of the pigs owned by the local hog raisers are coming from other piggeries outside the Malaybalay City. The 33% are from their own production, and the 13% are the piggeries inside the Malaybalay City. In that case, the local hog raisers from Malaybalay City, Bukidnon are flexible to fight against the African swine fever.
For the conclusion, the researchers have concluded that the local hog raisers are aware of and capable of dealing with the African swine fever, and that they are constantly receptive to new knowledge and understanding in dealing with the specific virus. Also, data collection reveals that all of the local hog raisers are educated with African swine fever when answering questions about it. It concludes that the prevalence of local hog raisers toward establishing preventive measures is significant in terms of sanitary measures, where each local hog raiser cleans when going in and out, and they always monitor their temperature and blood pressure and the availability of vitamins and medicines. And furthermore, this study is limited to assisting local hog raisers in maintaining their sanitary and preventive measures against African swine fever, to measure hog raisers' abilities to resist the said virus while maintaining a clean environment to prevent infections and diseases. This study does not include any medical treatment on how to fight African swine fever or cure the virus, but rather help the community on how to manage it and prevent the widespread. That will be all. Thank you.
Good day everyone, I am Cassandra Nicole Tamayo and I will be presenting our introduction. The Congo hemorrhagic fever is a tick-borne zoonotic disease transmitted from an animal to a human host, which is extremely fatal. The World Health Organization mentions that 61% of human diseases originate from zoonotic diseases. The CDC and the World Health Organization works 24/7 to protect people from zoonotic diseases, not only in the United States but also from a global scale. The main objective of this study is to assess the effectiveness of preventive measures against Crimean Congo hemorrhagic fever. Similar studies were also conducted in Georgia, Iran, and Pakistan, and they discovered that people who work closely with animals are at risk. Presently, there is still no recorded case of CCHF in our locality and anywhere in the Philippines.
Transmission of Crimean Congo hemorrhagic fever begins with the tick that is infected with the virus, as it latches onto a host, namely cattle, sheep, goats, and hares. The spread of the virus starts when the tick bites the animal and the animal carries it, which then infects other animals in the surrounding area. The animals show little to no symptoms of the disease, but when infected to humans, it becomes fatal. There is no known cure or vaccine yet for this disease, but a vaccine is still in development which has yet to prove its efficacy and safety. But there are other ways of controlling and preventing the spread of this disease. By using acaricides and isolating infected animals from other animals, we can slowly but surely control the infection rate of the virus.
The discovery of the Crimean Congo hemorrhagic fever dates back to the 1940s. In the summer of 1944, during World War II, when 200 military personnel in the Crimean Peninsula developed an acute febrile illness with hemorrhage and shock, investigators determined that the disease had developed following tick exposure. The virus was renamed CCHF virus, or CCHFV, in light of its antigenic similarity to the virus isolated in the Congo. Cases were reported from the former Soviet Union and Bulgaria. Outbreaks were then seen in some parts of Africa. A number of cases have also been reported from Middle Eastern countries, and most cases reported in the last decade have been from Pakistan, Iran, Bulgaria, India, and Turkey.
Good day everyone, I am Jacqueline Telasan and I will explain to you our findings through 4 levels of analysis: the research question, the theme, the meaning, and the evidence. Let's go!
The research question: what are the most efficient and effective preventive measures and control against Crimean Congo hemorrhagic fever? The theme is by implementing the 6 measures for the prevention of Crimean Congo hemorrhagic fever are controlling animal movements, tick control with acaricides on animals, prevention of tick bite, personal protection during slaughter, proper waste management after slaughter, and education of veterinarian slaughterhouse workers. So basically, businessmen and farmers who will apply the implementation of these measures is supposedly to be more safe and secured against any threat and problems that may occur with CCHF in the future. According to the European Center for Disease Prevention and Control, or the ECDPC, prevention and control of CCHF infection is achieved by avoiding or minimizing exposure to infected ticks by using tick repellents, wearing protective clothing, and early and correct removal of ticks are also recommended. And that is the end of our findings.
Good day everyone, my name is Glenford Casinoro and I'll be presenting the conclusion of our research journal article. Crimean Congo hemorrhagic fever virus often appears to be a neglected disease, as it usually occurs in remote areas in developing countries. CCHF virus is one of the viral hemorrhagic fevers with a high CFR and it's tick-borne. Therefore, its eradication is impossible. It appears symptomatic in animals but can be a serious threat to humans. This disease typically begins a non-specific flu-like illness, but some cases progress to a severe life-threatening hemorrhagic syndrome. There is currently no specific prophylaxis or vaccine against CCHF, and it is considered an emerging arboviral zoonotic disease in many countries. In order to prevent the introduction of CCFH into new regions and to protect the community, this review provides a strategy to clarifying the risk threat of every country and region as a foundation for managing the risk prevented by CCHF virus.
Good day. I am Graf Dayan Aitorigosa, a member of the Group 10 researchers of the Doctor of Veterinary Medicine and Central Mindanao University. We are going to present our paper titled Anthrax or Bacillus anthracis infection in domestic and livestock animals in Pangatukan, Bukidnon, Philippines. Our presentation tackles the following: the introduction, review of literature, findings, and lastly conclusion. The introduction. The majority of human infectious diseases have animal origins. One of these diseases is anthrax, a soil-borne bacterium capable of producing spores and is transmitted by close contact with any infected animals. 2,000 to 20,000 humans per year are affected globally. Is there any more risk of this anthrax? Yes. The Centers for Disease Control and Prevention stratifies anthrax as a Category A, an extremely dangerous bioterrorism agent. Some interventions were already undertaken internationally and locally, but several studies accentuate it as an inadequate. Thus, the resurgence of anthrax is still likely possible. As much as possible, we need to be aware. Anthrax prevention for biodiversity protection.
Now these are the titles of the review of related literature of our study. I will give a brief overview of each title. Let us begin with the disease and its history. Goel identifies anthrax as the disease, and Chu states it was first mentioned in 1491 BC. Next are the transmission and clinical findings by Vincent Ischetti. De Merdag et al. States that majority of anthrax cases occurs in places with minimal vaccinations. Next are the breakthroughs. Goel says that research in anthrax has led to a lot of medical developments. Next are the global infection and ramifications. Rahman et al. States that anthrax is one of the most hazardous threats to health. Lastly is the future of anthrax bacterium. World Health Organization accentuates that international organizations have now been creating vaccines against anthrax. These are some of our related literature regarding anthrax. Now let us proceed to the findings. Never forget, anthrax prevention for biodiversity protection. Thank you.
Good day. As of the findings of our research, we have found out that among the realm of domestic animals, ruminants such as cows are more susceptible of the infection, which has the highest ratio in the graph due to the environment they live in, which is a rich propagation venue for the anthrax bacterium, followed by canines and felines, which has a 32% rate in the graph, but do note that most of these are strays and feral. From Fischetti Bacteria Blueprint, we have dug deeper and discovered that enzymes such as alanine, histidine, and proline are effective in denaturing Bacillus anthracis protein strands. The same principle is applied in market-available antibacterial solutions. For this being said, it is possible for us to develop a more efficient and cheaper solutions in the near future. L-alanine in particular is a proven and tested denaturing element against bacteria strands in both internal and external host settings, which is a valuable component in preventive solutions and developed vaccines. Anthrax prevention for biodiversity protection.
In the view of the findings of the study, the following statements are concluded. First, anthrax infection susceptibility in animals are 32% for canine and felines, while 68% are for ruminants. Second, Vincent Fischetti was a stepping stone in creation of bacteria and viruses vaccines, including the vaccine for anthrax bacterium. And lastly, the L-alanine is by far the most effective enzyme in fighting with anthrax bacterium for its high effectivity in denaturing Bacillus anthracis strands. On behalf of my group mates Elroy, Graf, Dominic, and also on behalf of me, thank you for listening and God bless us all. Never forget, anthrax prevention for biodiversity protection. God bless.